How to heal an L4-L5 or L5-S1 disc herniation without surgery. If you've been told surgery is your only option for an L4-L5 or L5-S1 disc surgery, I want you to pause for a second and hear this first. Despite the MRI findings, despite the horrible pain shooting down your leg, despite everything you've tried, there is a way to heal without surgery. And the likely reason has nothing worked so far isn't because you're broken. It's because no one really has looked at you as a whole person, as a whole spine, or at the root cause behind the disc damage. If your entire spine has been structurally evaluated with full spine x-rays, then your care is just based on symptoms and not on correcting the root cause. So you have to look at the whole spine. In this video, I'm going to walk you through the exact three-part treatment system we use in our clinic that's helped thousands of people recover from disc herniations without surgery. It's not more stretching, it's not more injection, and it's definitely not just masking the pain. So stay with me because I'm going to show you how this system works, why it's so effective, and how to find the right doctor in your area trained to help you avoid surgery and finally heal. I'm Dr. Gregory Kramer. I got over 33 years of clinical experience and certifications in chiropractic biophysics. I specialize in treating chronic spine pain. That means L4-L5 disc herniations. That means chronic whiplash. And I also treat chronic problems that stem from spinal problems like neuropathy, chronic knee problems, and a host of other degenerative conditions. I use a non-drug, non-surgical treatment plan. In other words, I address the root cause. We typically use mirror image or opposite posture, exercise, adjustments, and traction. We typically use spinal decompression. That's non-surgical spinal decompression to decompress the disc, the joints, and the nerve, and a variety of targeted exercises that help your body heal and repair. Now, before I continue with this video, you guys know what to do. Just like and subscribe if you want to learn more how to eliminate pain, stabilize your spine, avoid surgery so you can live stronger longer. Just go ahead and click the bell. If you're watching this, chances are you're frustrated, maybe even starting to lose hope. I don't blame you. I've been there. I have 2 disc herniations. If you go back in my videos, you'll see where I was. So let's make sure you don't have any emergency signs that needs immediate surgery. We've talked about that in the past. Things like you can't control your bowel or bladder and severe foot drop. So if you can control your bowel and bladder, you can get some sleep at night. You need to get through that first week of horrible pain. Okay, you might need some anti-inflammatories. You might need some natural solutions, but you gotta get through that first week where you're really inflamed. So here's the basic advice. Bottom line is, people have tried physical therapy. You took the medication. You probably got a few epidurals. You rested, you iced, you prayed, and yet that pain is still there. It's still interrupting your sleep, still making daily life harder than it should be. You're probably asking, what am I missing? Or worse, is surgery really the only thing left? Well, I want you to hear this clearly. Your frustration is very valid. Your fear is real, but most importantly, your pain does not mean you're out of options in the majority of cases. When I say majority, we're talking like 97% of the time. You're looking at an old guy, and I've seen over a couple 100,000 office visits. What's missing isn't effort. What's missing is understanding, a complete understanding of why that disc herniation is there in the first place. All right. Yes, it's possible you could have a perfect spine and you got in a horrible accident, but that's usually not the case. See, most treatments only target the pain, which is your back, your leg, the inflammation. But very few providers assess the entire structural situation of your spine. How you stand, how you move, what's actually causing stress on the disc to begin with. If the underlying problem or weakness or imbalance isn't found and corrected, no amount of therapy, pills, or injections are going to create lasting relief. And that's why the pain keeps coming back. This is where things change. This is what I do differently. And that's why many people who come to my office finally start to heal after months, even years of disappointment elsewhere. Now let me walk you through the exact three-part system that helps people heal naturally from an L4-L5 disc herniation without surgery. Let's start with step one. All right? The most important thing we got to do is we got to get an entire spine evaluation with an x-ray. So this first step is different than most people experience. We don't just look at where the pain is. We evaluate the entire spine using a full spine x-ray, a full spine model. We look at your posture. We look at it from the front. We look at the curves from the side. We look at the global alignment from head to toe. Why? Because the spine is a single connected structure. It's one organism. A misalignment in your neck or upper back can create a ripple effect that changes how pressure travels down your spine. That stress also often funnels into your lower back, right at L4-L5, causing or worsening a herniation. So unless we affect the global alignment, your disc will keep taking the hit, no matter how many local treatments you try. In other words, your rib cage is 3/4 of your body weight. But if your rib cage is shifted right or left or forward, that weight is bearing uneven on the disc. So we're talking about the loading structure. So very commonly with a full spine analysis, we often find hidden structural problems no one else has ever pointed out. Using this insight, we build a personalized corrective care plan designed to restore alignment, improve movement, reduce disc pressure. That's key. You got to reduce that disc pressure and promote actual healing of the disc, not just temporary pain relief. This isn't about cracking your back or getting a quick fix. I use a specialized technique called chiropractic biophysics combined with spinal decompression. I'm certified in this approach, and I have experience and equipment to use the right tools at the right time, addressing the cause, not just chasing your pain. When a spinal structure is corrected, patients consistently improve posture, better movement, less nerve irritation, oftentimes within just a few weeks. But structure alone isn't enough. To keep that spine strong and stable, you also need to rebuild the internal support, and that's exactly what we do in the next step. One of the biggest problems people make is following a generic advice they found online. Random stretches and core workouts might feel productive, but if your spine isn't properly aligned, the wrong movements can actually make the problem worse, not better. That's why we don't give one size fits all. We prescribe targeted corrective exercise based on your unique spinal structure and x-ray findings. These movements are designed to do 4 essential things. Number 1, they got to stabilize your spine. Number 2, we want to restore the proper alignment or posture. Number 3, we want to decompress the disc and strengthen the core that keeps everything protected. When you follow the right plan, 3 things typically begin to happen. First, pressure comes off the disc and surrounding nerves, and that eases and reduces back and leg pain and inflammation. Second, you build strength and endurance in the muscles that support the spinal stability. And third, you begin to trust your body again. You feel more mobile, more capable, and more in control of your recovery. But for many patients with chronic or severe disc issues, there's one more tool that can take your recovery even further. When the pain just won't let up, let me show you what that is. Non-surgical spinal decompression. Imagine this, gently pulling pressure off a herniated disc so your body can finally start to heal. That's exactly what non-surgical spinal decompression is designed to do. Imagine you've been agonizing with pain, back and leg pain. I've had that. You're a little nervous, right, to get adjusted. I was too. However, when you're on a decompression, it just takes pressure off. I fall asleep. Many of our patients fall asleep. It's that comfortable, okay? This is an FDA-cleared treatment, uses advanced mechanical traction to create a negative disc pressure inside the disc. This negative pressure does a couple powerful things. One, it helps to retract the herniational bulge off the nerve, and it draws nutrient-rich fluids into the disc to support healing from inside out. Remember, healing is always an inside-out job. Now, let me be clear. This isn't the same as an inversion table or basic traction. Okay, true spinal decompression is controlled. It's customized. It's precise. It's based on your spine's exact condition and your x-ray findings. When done properly, it's gentle, safe, and highly effective, even for severe disc cases. So it's a pumping mechanism, all right? Whereas if you just do normal traction, there's constant force, and that what happens is your muscles start to guard. The same thing with an inversion table. You need to create a pumping mechanism that's pressure on and off. That pumping is like getting a sponge, soaks up fluids, pumps the bad stuff out of the disc and the good stuff in. We want a fluid exchange, and that's what helps with the healing process. Okay. Now, we put it all together. I combine spinal decompression with corrective care and targeted exercise. We create a system that does more than just relief pain. It restores function. It stabilizes your spine. It helps you return to everyday life without surgery, without long-term drugs, and without giving up hope. Just because you've been in pain for a long time doesn't mean you're stuck that way forever. Absolutely not. Like I said, 90% of the time we can help people avoid drugs and surgery. Thousands of patients have followed this exact three-part system in my office: corrective chiropractic care, targeted spinal exercise, non-surgical spinal decompression, and many of them avoid surgery entirely. They're now living with less pain, more strength, greater confidence, and doing all the things you want to do. So if you're wondering how to find a doctor who offers this type of care, here's a simple place to start. Look for a provider trained and certified in chiropractic biophysics. You can go to idealspine.com. Listen, I want your questions, all right? However, please don't ask me how to find a doctor. I'm telling you right now. Go to idealspine.com and find a chiropractor certified in chiropractic biophysics in your area. And many of those doctors, I would say, offers non-surgical spinal decompression and targeted corrective exercise. They will give you the best chance to receive care that doesn't just manage pain or treat symptoms, but actually heal for the long term. If this video gave you value or helped you in your situation, or actually see your situation differently, do me a favor, like and share it so more people can find answers and avoid unnecessary surgery. I'd also love to hear from you. Drop a comment. Let me know your biggest takeaway and what gave you the most hope. And remember, hit that subscribe button if you want to learn how to eliminate pain, stabilize your spine, avoid spinal surgery so you can live stronger longer. Now, if you want to get started with some of the best exercises that help relieve an L4, L5, or L5-S1 disc pain, watch this video next. Best exercises to help get rid of pain from an L4, L5 disc bulge and an L5-S1 disc bulge.